You treat the patient sitting right in front of you, but if their partner isn't treated, well, that infection is just going to come right back, isn't it? We've all seen it. Welcome to this explainer, designed directly for you, the California healthcare provider. Today, we're going to help you confidently use expedited partner therapy to finally break that cycle. We know there are hurdles out there, legal fears, clinical confusion, and those endless billing headaches, but we are going to break every single one of those down today. So here's our game plan. We're going to quickly hit the EPT basics, dive into your legal protections here in California, map out the exact clinical guidelines, show you exactly how to write the scripts, and finally, touch on counseling. Just so you know, everything we're breaking down in this explainer comes straight from the official November 2023 guidelines prepared by the California Prevention Training Center. This is the gold standard. It's state-sanctioned, highly researched, and exactly what you need to be doing to align with the latest public health recommendations. All right, part one, the basics of SEPT. Let's make sure we're all starting on the exact same page. So what are we actually talking about here? Expedited partner therapy is basically patient-delivered treatment. The patient you just diagnosed, they physically hand the meds or the prescription directly to their partner. Boom! You're completely bypassing the need to get that partner into a separate clinical exam. Sure, getting everyone into the clinic would be amazing, but let's be real, it's just not always going to happen. EPT is that highly effective, super safe workaround to ensure timely treatment. Now, who actually gets it? Pretty much any sex partner from the 60 days prior to your patient's diagnosis is good to go. Or, if it's been a while, just their most recent partner. But, and this is a massive but, you absolutely have to hit the brakes if you suspect child abuse, sexual assault, or intimate partner violence. Handing over meds in those situations could put your patient in real danger. We also skip EPT if the partner has a known severe antibiotic allergy or if there's a co-infection that these specific drugs just won't knock out. Patient safety is always your primary filter. Moving right along to Section 2, and honestly, this is the big one for a lot of folks, California legal protections. Listen, if you've ever felt that pit in your stomach about prescribing meds to someone you haven't actually examined, you can completely let that go. Thanks to Senate Bill 306, you have explicit, bulletproof permission to prescribe EPT. Whether you're an NP, a PA, a physician, or a nurse midwife, as long as you're following the guidelines and not engaging in gross negligence, California law literally says you will not be liable for medical malpractice. Period. You are completely legally covered. And guess what? That legal shield covers your colleagues at the pharmacy down the street, too. Pharmacists are fully protected from liability when dispensing these EPT meds, even if they're looking at a prescription that literally has no patient name on it. It creates this beautifully sound legal pipeline straight from your clinic right into the partner's hands. Okay, Section 3, clinical guidelines and regimens. Let's get into the actual medications. You might actually want to snap a quick photo of this. It's basically your clinical cheat sheet. For chlamydia, we're talking doxycycline, 100 milligrams twice a day for 7 days. For gonorrhea, it's a single 800 milligram dose of oral cefumoxime. Now, a quick side note here. Yes, an injection is definitely optimal for gonorrhea, but EPT is all about access. So if that partner isn't going to come in, oral cefumoxime is the move. Just remind them it might not fully clear a throat infection. And finally, for trichomoniasis, you're using metronidazole. 7 days if they're at risk for a cervical vaginal infection, or a single 2-gram dose for a penile infection. Now, a super important detail about chlamydia. Doxycycline is absolutely your go-to, but remember, it is a Category D drug and contraindicated in pregnancy. So if your patient says their partner is or even might be pregnant, no doxycycline. In those specific cases, or honestly, if you strongly suspect they just won't finish a 7-day pill routine, azithromycin steps in as your safe single-dose backup plan. All right, on to Section 4. How do we actually write this thing out? California actually gives you 3 totally legal ways to do this. Best case scenario, your patient gives you their partner's name, and you just write a separate script. Easy. Or write one prescription, put both names on it, and just double the pill count. But, and this happens all the time, what if they don't know the name or they just don't want to give it to you? No problem at all. You leave the name blank, but you literally must write the letters EPT on the prescription. That's the magic word. It signals to the pharmacist exactly what's going on. Take a look at how this plays out in the real world. This specific script is for the index patient, but check out the dispensing instructions at the bottom. The provider wrote, "Please dispense in 3 labeled bottles of 14 for index patient and 2 partners." This is absolute best practice, you guys. It makes life so seamless for the pharmacist, and it ensures your patient can just hand over a clean, separate, ready-to-go bottle to each partner. But here's the million-dollar question, literally the one your patients are going to ask you every single time.
Wait, who's paying for my partner's pills?
Well, I've got fantastic news for you. As long as you write the prescription under your enrolled index patient's name, Medi-Cal and Family Pact will cover the treatment for your patient, plus up to five, partner doses per dispensing. It literally doesn't matter if those partners even have insurance themselves. The system just gets it. Treating the partners is the single most cost-effective way to stop your patient from getting reinfected.
Finally, Section 5. Let's talk about safely counseling your patients and their partners. Before we even touch on side effects, look at this number: 0. What's truly wild is that since 2001, there have been exactly 0 adverse events related to EPT reported to the California Department of Public Health. Not a single one. As long as you're doing that basic screening we talked about earlier, this is a mind-blowingly safe intervention. Of course, you still got to do your counseling. You can confidently reassure them that apart from a little bit of mild stomach upset, maybe some nausea, severe reactions are incredibly rare. But you know the drill. Always advise them to pass along the standard allergy warnings. If a partner has a known history of severe IG-mediated allergies to penicillin or cephalosporins, they shouldn't just pop these pills blindly. They definitely need to consult a doctor first. So here's your quick checklist for the patients sitting in your office. You have to hammer home that abstinence during treatment is completely non-negotiable. If it's a single dose, no sex for 7 days. If it's a 7-day pill course, no sex until that very last pill is swallowed. If they cheat on that, they're just going to ping-pong the bug right back to each other. Tell them to hand over the info sheets along with the meds, encourage the partner to eventually go get a full in-person evaluation, and, crucially, book your patient for a 3-month retest to make sure the infection is totally cleared. So think about it. You've got bulletproof legal protection, crystal clear clinical guidelines, and state programs literally offering to foot the bill. The biggest hurdles? They're gone. The power to physically break the chain of STI transmission is sitting right there at the tip of your pen. So take a look at your patient schedule for this week. How many repeat infections could you prevent just by scribbling the letters EPT on your next prescription? Thanks for joining this explainer and for everything you do to keep California healthy.